This presentation from WholeHealthWeb.com is about your blood tests and what they're really telling you, and how even a normal blood test can give you insights into your health. And the question is, if the doctor says your tests are normal, are you healthy? Blood tests are generally used to find disease, verify a diagnosis, or to rule out certain conditions. They're looking for abnormal values to see what's wrong. What many people don't realize is there's an art and science to interpreting a blood chemistry. Even a normal test can give insights into your nutritional status and even predict future health problems. See, there's a difference between normal and healthy. Okay, normal means average or within a certain range, and also means there's no pathology present. Okay, they look for abnormal to identify pathology. And in a sick population, normal value might actually change, and these values do change from time to time. But if you're looking for, we're going to introduce a concept called physiologic normal, which is what are your tests ideally? Okay, normal means not sick. Physiologic normal means healthy. The other thing we want to talk a little bit about is there are patterns that exist in groups of tests. So one test can give you an idea that there's a health issue. A second or third test can support the results of the first test. This is one of the reasons why we like to recommend broad tests. They're blood chemistries that might have 40 or more components to them. And it is better to look at the whole picture rather than to obsess over a single result like cholesterol. We'll give you an example of physiologic normal. There's a measurement called the MCV, mean cell volume, which tells the size of a red blood cell. The range is between 80 and 100. Okay, in certain anemias, the MCV, namely pernicious anemia, the MCV will become greater than 100. Okay, the question is, who's healthier? Someone with an MCV that is 88 or someone with an MCV that is 99? And actually, the physiologic range, the ideal range, is below 90. Okay, so a person with 99 is not ideally healthy, even though their test is normal. And if you look at this, pernicious anemia is a very debilitating condition. Severe B12 deficiency will lead to severe neurological damage, depression, forgetfulness. It's even mimicked Alzheimer's disease. Okay, and the interesting thing about pernicious anemia is the neurological symptoms happen before the blood test confirms the problem. Now, people in natural health care will say, well, if 100 is bad and 90 is ideal or 88 is ideal, if I have a value of 95, is that telling me is that the body telling me that, gee, maybe I need a little more B12? You know, and if someone has this 95 value and they're forgetful or their feet are numb or they're depressed, which are all signs of B12 deficiency, doesn't it stand to reason that giving the person B12 might be worthwhile? Similarly, you can learn a lot from patterns. Okay, everyone wants their cholesterol to be below 200, but there are other values that give you information about potential for heart disease. Triglycerides, LDL or bad cholesterol, HDL or good cholesterol. Sometimes you'll see a pattern where the triglycerides and the LDL, the bad cholesterol, are high, and the HDL is actually low. We call that metabolic syndrome or syndrome X, and very commonly this person was having a problem with carbohydrate. So they see a low cholesterol and say, oh gee, I got to eat less fat. When in reality, the culprit is sugar, white flour, things like that. And if it left unchecked, this can actually develop into diabetes. So it's worth looking at. Another thing, if you did another test here, CRP or C-reactive protein. C-reactive protein is a measure of inflammation. So if you've got high LDL and high CRP, your chances of forming plaque and blocking your arteries go way up, and that's a much more serious marker than a high total cholesterol. Looking at cholesterol is just a very superficial way of looking at things. Like I say, if you look at the values and you found this metabolic syndrome or syndrome X type of individual, and you know the person has a problem with insulin, if they don't change their lifestyle, eventually you'll start getting tests that show diabetes. The blood sugar will start coming up, the triglycerides will get higher and higher, and so on. So if you see this pattern, you're able to prevent problems, and not only lower the cholesterol, but prevent them from developing a more serious problem later on. So detailed knowledge as obtained from blood chemistry can help you develop a plan that will improve the health, energy, and quality of life of your patients. Another example of reading between the lines is in thyroid. Most of the time, the doctor's office will do what they call TSH, and that's the only test they'll do. And TSH isn't actually a thyroid hormone, it's a pituitary hormone. It's the measure of how hard the pituitary is telling the thyroid to work. And the British Medical Journal recently published an article discussing the flaws in this way of diagnosing hypothyroidism. There's a lot of people with hypothyroid symptoms that are walking around and saying, oh, my TSH is normal, therefore my thyroid is normal. And that might not necessarily be true. Symptoms and other lab values can play a role. The normal lab range for TSH is from 0.45 to 4.5. A lot of natural health care practitioners believe that if the symptoms are present, a TSH as low as 2 might be telling you something. You might need some nutritional support. Also, some of the other tests, T3, which is the active form of thyroid hormone, T4, which is the less active form, sometimes you get clues on the person's nutrition and why they have hypothyroid symptoms. So you have to combine all of this information. People trained in natural health care understand this. Symptoms are very important with thyroid. And here's a list of them. You might have some or all. Feel cold when others do not. Fatigue, lack of motivation, just can't get going. Poor memory, poor concentration, loss of interest in sex. Dry, itchy, or scaly skin. High cholesterol. Muscle cramps. Constipation, cysts and fibroids. Crying for no reason is a biggie. Puffiness under the eyes, ankle swelling, depression. There's a lot of people on antidepressants that actually have low thyroid. Person catches cold a lot. And of course, the biggie is the inability to lose weight. Person living a very proper way, diet and everything, and just can't seem to lose the weight. And in natural health care, we like to get as complete a study as possible. And there's a trend away from this. Blood chemistries are relatively inexpensive, but they get marked up a lot. And insurance companies try to save money by only approving limited tests and grouping them in these small groups. And that's unfortunate because the more tests you get, the more information you have. There are labs like Professional Co-op that will perform chemistries that contain more tests than usual. People in natural health care like this because lots of information is good, and they are. Overall, it's the most bang for your buck in medical diagnosis. And there is a computer analysis available. This gives me an opportunity to talk about Dr. Harry Eidner, who participated in a program called the biochemical biopsy, where they took 10,000 patients. They looked at their blood chemistries, their medical histories, and saw where their health ended up, and made some distinctions over what blood chemistries were actually telling us. And Dr. Eidner actually developed a computer program that reads these physiologic normals and points out these patterns to the practitioner. It's a very valuable and very powerful tool. It's a little bit controversial because this work is truly unique. It's hard to find other stuff in the medical literature that supports it. At wholehealthweb.com, we try to give you the best scientific evidence to natural health care that we can. And sometimes you go into controversy with it. The reason I say it's controversy because it's not a lot of other people have done this work and say, "Hey, Dr. Eidner was right or wrong," or double checked it. Except for the thousands of practitioners that use these values and get people better on a regular basis. And it seems to be okay to do that because, once again, you're dealing with nutrition. You're dealing with a very low risk therapy that produces high yield, high results, low risk, high gain therapy, and someone who's professionally trained giving the advice. We don't want you interpreting your own blood chemistries. You can enjoy some very good health benefits, and if you're seeing this on a practitioner's website, chances are that they subscribe to this method of looking at blood chemistries, and it's a very smart thing to do. And this has been a presentation of wholehealthweb.com. We hope you'll come and visit the site. There's lots of free information. There's free ebooks for you. There's hundreds and hundreds of articles. There's videos. There's downloadable MP3 files about health and advice about diet. Our idea is that the health bill in the United States is $2.7 trillion a year, mainly because people don't understand simple, inexpensive, natural health care. You can go there, you can link to a practitioner, and we hope you'll check out the site, and we hope you enjoyed this presentation.